Welcome! If you're joining me for this explainer today, chances are you, or maybe someone you love, is navigating the often overwhelming world of fertility care. And I just want to start off by saying, you're in a safe space. You know, the world of reproductive health, it's filled with complex terms, endless tests, and honestly, a lot of unanswered questions. But we're going to dive into this together. My goal today is to be your supportive guide. We're taking a very specific, sometimes intimidating topic, sperm DNA fragmentation, and we're going to break it down into clear, completely understandable pieces.
Because navigating fertility roadblocks, it carries an immense emotional weight. When standard tests come back totally normal, but you're still struggling to conceive, it can really feel like you're just wandering in the dark. But the really reassuring news here is that medical science has tools to help turn those lights on. Sometimes when building a family gets tough, doctors need to look much deeper than a standard evaluation. They literally have to zoom in to a microscopic level. Think of human reproduction as this highly complex recipe. If the recipe isn't turning out quite right, you don't just look at the ingredients as a whole, right? You have to look at the microscopic building blocks of those ingredients. Sometimes, the missing puzzle piece in your journey isn't something you can just spot on a basic surface-level scan. It requires looking right down at the very genetic instructions that actually create life.
So, what exactly are we looking for? Well, this brings us to a test called Sperm DNA Fragmentation, or SDF for short. In really plain language, SDF is just a test designed to check the integrity and the health of the genetic instructions carried inside the sperm. That's it. It's simply a tool. It lets doctors see if the genetic material inside is perfectly intact or if it's been damaged or broken in some way, which is exactly what that word fragmentation means. It's all about ensuring the blueprint for life is healthy and ready to go.
Now, you might be sitting there wondering, is this something absolutely everyone should do right out of the gate? Well, no, not necessarily. Let's look at the specific clinical scenarios where fertility specialists most often recommend checking for SDF. There are three main scenarios, and I want to acknowledge right off the bat how incredibly difficult it is to experience any of these. First, doctors recommend SDF testing for couples dealing with recurrent pregnancy loss. We now understand that if the genetic material inside the sperm is damaged, it can directly impact embryo development and actually increase miscarriage risk. Second, it's highly recommended for patients with unexplained infertility. You know, when all the basic tests say everything should be working perfectly, but it just isn't. And third, for couples with failed assisted reproduction, things like IVF or ICSI cycles that simply didn't result in a successful pregnancy. In all of these heartbreaking situations, SDF testing offers a much deeper look. Look, I know that actively searching for more potential problems can feel really scary, but I want to reframe this for you for a second. Taking this test is actually a really positive, proactive step. SDF testing is an empowering tool to gather critical information. It is absolutely not something to fear. Instead of letting unexplained infertility remain this big, heavy mystery, this test gives you and your medical team hard data. It helps lift that burden of the unknown so you can finally map out a targeted plan. So how does the testing actually work in a lab? Let's break down some of the complex clinical jargon into simple, bite-sized concepts so you feel fully informed and totally confident.
Basically, there are two main buckets of SDF tests out there, direct and indirect. Let's look at direct tests first. These actually use special probes and dyes in the lab to measure the exact extent of the DNA damage. They literally highlight the broken pieces directly. On the flip side, indirect tests take a slightly different approach. They check the DNA's susceptibility to something called denaturing. In everyday terms, this just tests how easily the DNA breaks down or falls apart when exposed to stress. And that happens much more commonly in DNA that is already fragmented.
Now, if you and your doctor decide this is the right path for you, you're probably going to see some very complex acronyms pop up on your lab forms or in your patient portal. Medical paperwork can honestly look like a giant bowl of alphabet soup, and it can be incredibly intimidating. But please, don't let those long medical letters worry you. They are just the technical names for the direct and indirect tests we just talked about. Here are the three most commonly used methods you might actually run into. First is TUNEL, which stands for Terminal Deoxynucleotidyl Transferase DUTP NIC End Labeling. Wow, okay, you can definitely see why they use the acronym for that one. Then there's SCSA, or the Sperm Chromatin Structure Assay, and finally the SCD, which is the Sperm Chromatin Dispersion Test. You absolutely do not need to memorize these names. Just know that if your doctor mentions TUNEL, SCSA, or SCD, they're simply talking about the specific lab method they prefer to use to measure that DNA fragmentation. The whole shebang is just about getting those answers.
Okay, so the testing is done, the results are in. What do we actually do with these answers once we have them in hand? Well, let's look at how this exact information helps map out a path to finally building your family.
Finding fragmentation helps your doctor outline highly actionable next steps. It isn't just bad news, it's actually a roadmap to treatment. For example, SDF results can identify men who are fantastic candidates for a procedure called a varicocelectomy. That's a surgery performed to remove enlarged veins in the scrotum, which are a very well-known cause of DNA damage. Alternatively, the test can point heavily toward infertile men who have been exposed to lifestyle risk factors that are actively damaging the sperm.
Now, I want you to notice that very first word, modifiable. Modifiable lifestyle risk factors. I really want to emphasize this because it's genuinely the biggest beacon of hope in this explainer. If the fragmentation is being caused by lifestyle factors, it means it is actively in your power to change it. This test is all about finding things you can improve, whether it's making changes to your diet, addressing environmental exposures, or just tweaking daily habits. Identifying these factors means you can actively improve the health of the sperm's genetic instructions.
You know, knowledge truly is power, especially when you're navigating the heavy, winding road of fertility care. Getting to the root cause of recurrent pregnancy loss or unexplained infertility isn't just about closing a chapter, it's about confidently opening the next one with the right treatment plan in hand. So my final question to you today is this. Are you ready to ask your doctor if SDF testing is the next empowering step in your journey? Remember, you are your own best advocate, and asking the right questions is exactly how you move forward. Thank you so much for spending your time with me today, and I really wish you clarity, hope, and success on your path ahead.